Breastfeeding Initiative. I'm Shawn Brown, Program Officer with the Kansas Health Foundation. And joining me today are my colleagues, Elisa Bullard, Grants Officer with the Kansas Health Foundation, and Katie Ross, Program Officer with United Methodist Health Ministry Fund. Just a couple of items of housekeeping. The webinar is being recorded, and the Q&As will be posted on the Kansas Health Foundation website. All callers are in listen-only mode, so to ask a question, please type it into the question box at the right of your screen, and we save time so that you can we save time so that basically we'll cover your questions at the end. So my colleagues and I will be providing an overview of the Kansas Breastfeeding Initiative RFP. We'll provide an overview of what we're looking for in the RFP proposal and describe the initiative, and then review the online submission process and answer any questions you may have. So I'd like to give you just a little bit of background as to why this work is important and why the Kansas Health Foundation and the United Methodist Health Ministry Fund decided to partner together to provide this opportunity. So we basically decided to partner together because both foundations have the goal to reduce childhood obesity and improve the overall health of children and adults by increasing initiation and duration rates of breastfeeding in Kansas communities. It's evident that breastfeeding provides immediate and lifelong nutrition and health benefits for mother and child, and larger economic, environmental, and social benefits to families and communities. Breastfed babies have a lower risk of becoming obese, developing asthma, type 1 diabetes, and respiratory infections. In addition, studies show that babies who receive breast milk only in the first 6 months of their lives have better educational and emotional outcomes. Breastfeeding also benefits mothers, lowering women's chances for ovarian and breast cancer and hypertension and heart disease. Also, in essence, it's really about a healthy start. Doesn't someone just starting out in life deserve the purest, freshest food source designed specifically for their needs? So, you know, if we could wave a magic wand and create a breastfeeding utopia, we would do it. But the truth is, we don't have a magic wand. But we recognize the importance of promoting policy and practice improvements to give all Kansans the opportunity for a healthy start in life. So how are we doing? Well, unfortunately, in Kansas, many babies and mothers are missing out on the benefit of breastfeeding, and that's especially true in communities with high levels of poverty and health disparities. In fact, Kansas ranks 48th when it comes to babies being exclusively breastfed at 6 months. So given the situation, you know, we recognized that we had an opportunity to promote breastfeeding in the community, workplace, and other settings to encourage and help all women and babies successfully breastfeed. So as we were thinking about this opportunity as well as some of the challenges, we called on the intellectual capital of several people actively working in the field to help develop a summit to bring a larger group of Kansans together to talk about strategies. So back in September 2014, the Kansas Health Foundation and the United Methodist Health Ministry Fund hosted the Kansas Health Summit on breastfeeding. And the purpose of the day was to convene national and state-level experts to explore opportunities for a healthier Kansas by overcoming barriers to breastfeeding. And it also provided the opportunity for participants to learn about available resources and contribute to the development of change strategies in Kansas to support breastfeeding, with the ultimate goal of improving breastfeeding initiation and duration rates. So summit participants determined priority recommendations for Kansas based on the CDC guide strategies to support breastfeeding mothers and babies. And so the strategies in the report represent the collective thinking of attendees at the time of the summit. And we recommend that you review the report in its entirety in the attachment at the back of the RFP. And it'll really give you a great snapshot of what happened at the summit. Now, as you're thinking about preparing your proposals and you begin to generate ideas about this work going forward, I also recommend that you read through the CDC guide as it outlines all 9 strategies and it's chock full of resources, program examples, and key considerations. By the way, if you haven't had a chance to listen to the pre-recorded webinar that was done earlier, I would also recommend that you listen to that in addition to this webinar. Again, we're excited about this initiative. We all have a role to play in the health of mothers and babies, knowing that we all benefit when more mothers and babies have the opportunity to breastfeed. And at this point, I will turn it over to Katie to go into more details regarding the CDC strategies and provide an overview of the RFP.
Thank you, Sean, for the introduction into this important work and our reasons for focusing efforts around breastfeeding. We at the United Methodist Health Ministry Fund and the Kansas Health Foundation see this as a vital need for improved practices in Kansas. And as Sean previously mentioned, when we were working on putting together the plan for the Kansas Health Summit on breastfeeding, we utilized those CDC guide to strategies to support breastfeeding mothers and babies to really shape and lead the conversation into more specific Kansas strategies. Again, we would really like to encourage you to think about how your proposal may tie into both the CDC strategies and the recommendations that emerged during the summit, which you will find in the full summit report that Sean mentioned before. And we wanted to briefly highlight those CDC strategies outlined in the guide. So the 9 practices include, the first one is maternity care practices to support breastfeeding related to the immediate prenatal care during labor and birth and postpartum. Professional education is the second one, and it is used to improve the knowledge, skills, attitudes, or behaviors of healthcare providers in relation to the importance of breastfeeding. The third one is access to professional support from healthcare professionals such as doctors, nurses, and lactation consultants. Number 4 is the peer support programs to encourage and support pregnant and breastfeeding women. And the 5th one is support for breastfeeding in the workplace through corporate policies developed to support breastfeeding women. The 6th one is support for breastfeeding in early care and education through child care arrangements that support breastfeeding mothers and ensure staff are trained to handle breast milk and mothers' feeding plans. Number 7 is access to breastfeeding education and information during prenatal and interpartum periods to increase mothers' knowledge and skills and develop positive attitudes towards breastfeeding. And then the 8th one is social marketing to promote breastfeeding practices in community, hospital, or workplace settings and educate policymakers and the public about healthy infant nutrition practices and support programs. And last but not least is number 9, monitor and address the marketing of infant formula to ensure potential negative effects on breastfeeding are minimized. Those as well, you will see the resource to find those at the bottom of the screen right now, which are, again, we would encourage you to find at later on and read through. So to move on from here, to give all mothers and babies the strongest chance at breastfeeding success, our culture needs to change. We recognize it takes everyone within a community to support breastfeeding to make this needed change. And we urge you to consider partners that are valuable supports to your work as you write your proposals. When writing your proposal, it lends itself to the importance of looking at this as an opportunity to step outside of those possible silos that exist and think about collaborators or partners in your local community, identifying key leaders in the community and those passionate about this work. This slide right here we have borrowed from the Kansas Breastfeeding Coalition. Part of the reason I wanted to use this graphic is because it raises the point that what I think many of us have heard numerous times is it takes a village to raise a child. And we know that we are all part of the system that needs to change to help support moms and babies to make breastfeeding utilized more within each of the communities and strengthened throughout. So the breastfeeding, we recognize that breastfeeding support needs to occur from the time of conception through delivery and continue to be supported when a mom returns to work and through the child care as well as in maternity care practices. This slide provides possible ideas of partners to consider. Again, like I said, as you can see, we have child care providers, possible leadership from the community, employers, peer support groups, maternity care. All of these assist mothers during a very vulnerable time, but it's also a very invaluable time to help the mother and child bond. So this is vital to the success of these projects, to think about the importance of collaboration and recognize that we all play a role in helping a mother and child receive the support that they need. As we mentioned in the value of the collaboration between key partners, you'll notice in the RFP that collaboration is one of the things that's discussed. Multiple partners may submit a joint proposal that reflects a collaborative approach. And as you're writing your grant, use the lead organization as the named applicant or grantee. Going on from there, the Kansas Health Foundation and the United Methodist Health Ministry Fund anticipate a broad range of organizations will be supported through this RFP. We are not limiting this to a specific type of organization. And some ideas of who may be interested in applying include those listed on this. So organizations and coalitions currently addressing breastfeeding rates in Kansas, possibly healthcare providers and organizations serving child care providers, local and state government, organizations addressing worksite wellness, and then organizations with expertise in chronic disease prevention and health promotion. Again, it's not limited to that, but those are specifically ones that we wanted to make sure and think about as possibilities. From there, diving in a little bit deeper about who may apply, you will see in the RFP that eligible applicants must be classified as a tax exempt under the Section 501c3 of the Internal Revenue or government, or as a government entity. Possible applicants can be a singular organization, a partnership of an anchor organizations, for example, like an educational institution or a community foundation, and then there's also the chance of utilizing an organization representing a larger community coalition. So moving on from there, just talking a little bit more about the other pieces of the RFP, thinking about available funding in the grant period. The award amounts are $25,000 up to $100,000 grants. And there will be strong consideration given to cost effectiveness of the proposals. The grant term is a 3-year maximum of 36 months. And the project start date will be July 1st with the ending of June 30th of 2018. Sorry, July 1st of 2015 through June 30th of 2018. Shorter grant timelines may be requested. Now that we've talked about who can apply and the grant award amounts and grant period, let's move into actual submission process. We'll talk about additional requirements and exclusions in the next few slides, and then discuss the grading of the proposals and important dates associated with the grant. So the first step of this, the grant process, is the submission of the letter of intent. This letter is due by April 17th, which is next Friday from today, so a week from today. If you don't have a letter of intent submitted by this time, your proposal will not be reviewed. So again, as we were just saying, within the letter of intent, you must include the name and address of the applicant and organization, primary contact person's name, title, and contact information, reason for interest in this initiative, 2 paragraphs or less, and identification of the CDC recommended strategy to be implemented, and last, the description of the proposal, which should be 2 paragraphs or less. So moving on from there, thinking about conflicts of interest, to avoid any real or perceived conflicts of interest, Kansas Health Foundation reserves the right to not fund organizations that have contracts with or receive funding from, including grants or sponsorships, a tobacco company or soft drink manufacturer. Applicants must include a signed statement describing any financial relationship with tobacco companies or soft drink manufacturers. From there, we're going to look at the important grant exclusions. So lobbying is one of them that would be an exclusion. A wide range of non-lobbying advocacy activities may be supported. Real estate acquisitions, and then last on here is the direct mental health and medical services. This does not apply to lactation consultant services, recognizing that may be a piece of this that needs to be included within the proposal that you submit. Moving on from here, let's talk a little bit about the proposal requirements. As you've seen probably in the RFP, this is the way that the scoring will be done. So the executive summary will not be scored, and it's a limit of 1 page. And then you would have the capacity and experience being one of the highest scored portions with a maximum score of 30 and the page limit of 3. I apologize. And then we move from there to the population and statement of need and readiness. That's a maximum score of 20, and it's a 2-page limit. And then we have the proposed project plan and the timeline, which again is one of the higher scored portions with 30 being the maximum score, and then it's a limit of 5 pages. The proposed project objectives are worth 10 points maximum, and it's a 1-page limit, and then we would need your staffing included as well, and it's a maximum of 10 points awarded, and then it has a 2-page limit with the budget of being worth 10 points, and there is no page limit on that one. As you can see, the total that would be possible for that is 110 points with a 14-page limit. We also wanted to make sure that you had the timeline that will be utilized for the remainder of the project and for the RFP process. So as I already mentioned, the letter of intent will be due on April 17th by 5 p.m. That was one detail I did not put within my last portion, but just be aware at 5 p.m. Central Time. Proposals are due by May 15th, 2015 by 5 p.m. as well. The grant awards will be announced by June 3rd, and then grant terms begin July 1st, 2015, and there will be an annual grant progress and financial status report due on April 1st of 2016, August 1st of 2016, August 1st of 2017, and August 1st of 2018. The grant end date will be June 30th of 2018 unless applicants request a shorter time frame. From here, I would just say at this time I'll turn the webinar over to Elisa to discuss the technical portion of completing the online letter of intent and the proposal, and then we will open it up for questions. Elisa?
Thank you, Katie. I'm going to first go over our website, which will connect you to the online process for completing the letter of intent and proposal. So our web address is kansashealth.org. So I'm just going to take us to that page. So once you get to our home page, to get to the Breastfeeding Initiative website that we've created, you'll scroll down towards the middle of the page. There's a quick link section on the right-hand side of the page, a little blue box, and you'll see there's a link to go to the Kansas Breastfeeding Initiative page. So once you get to this page, you'll see just a brief description of the initiative. And then as I scroll down, you'll see the information that you use to register for the webinar that you're on today. Once we get off this webinar, we will take the recording and get it posted, as well as the PowerPoint slides that we just reviewed. We'll get those posted by the middle of next week, so you can go ahead and share that webinar with others, or just listen to it again if you want to pick up some information. We also have the pre-recorded webinar that Sean briefly mentioned that highlights current initiatives, ideas on how organizations might partner, and potential resources that may help in your development of the proposal. As you scroll down further, you'll see the actual RFP document in PDF form, so you can go ahead and open that PDF document and get all of the information you need. Then we have just a brief description outlining the dates, the due dates for the letter of intent and proposal. So again, the letter of intent is due next Friday, April 17th, and then the proposal is due May 15th, which is a Friday at 5 p.m. And within that section, we have 3 different templates that will need to be opened up, completed, and then we'll have you upload those to the online proposal. And I'll go over that process as I go over the online proposal module, but I just want to briefly mention that that's where you'll find those templates. And then towards the bottom, under those templates, we have 2 other templates, which are the grant agreement templates, one for the Kansas Health Foundation and then one for the United Methodist Health Ministry Fund. So these grant agreement templates are mentioning the terms that you would need to agree to if you do get a grant from the Foundation or United Methodist Health Ministry Fund. And once you've reviewed those terms and are in agreement with those terms, you would fill out the template towards the top, which is the Acknowledgment of Agreement Review template. And that's going to be uploaded to your proposal. So again, I'll go over that as we get to the online process. If you do have any questions about the terms that are listed in either of those grant agreements, go ahead and contact me and we can discuss. Then at the very bottom, you'll find the link to complete the letter of intent. And then if you're having any issues with the online process, you can contact our grants associate, and her contact information is at the very bottom of the screen. So what I'm going to do is just open up this online letter of intent. So once I open up this link, it's going to take you to a sign-in page where you'll need to enter an email address and a password. So if you've used our online process before, if you've submitted any proposals to the Kansas Health Foundation, you can use that account that you've used in the past. Or if you've never used our system before, you'll simply need to select the New Applicant button underneath the email field, and you'll create an email and password. So I'll act as though I've already submitted through our system before, and I'll just log in with my email address and password. And once I've done so, it's going to take me to this one-page form that I'll need to complete. Again, it tells you the deadline for this letter of intent, which is April 17th at 5 p.m. Once that 5 p.m. deadline hits, we're going to automatically take this letter of intent off of our site. So please make sure that you get your letter of intent in on time. Some of the questions it will ask is just questions about your organization. So what's your name, your address, phone number, and then who's that primary contact? So who would we need to contact if we have questions about this submission? And then finally, we have two fields that will need to be completed. The first, your reason for your interest in this initiative, and then the description of the proposal. So once I've completed this letter of intent, I'll simply click on the Review and Submit button at the very bottom of the page. And once I've done that, it's going to take me to another page that will review everything that I've just entered on my letter of intent, just so I can review it one more time and make sure everything that I've entered is correct. And then you'll see a Submit button at the very bottom of the page. Once you hit that Submit button, you'll get an automatic email that will tell you that your letter of intent has been received from the Kansas Health Foundation, and you'll also, in that email, receive a link to complete the proposal. So again, you must complete your letter of intent using our online process so that you can then use the proposal link to complete the online proposal. So once I've completed this letter of intent, I'll get that email, and it'll give me the link to complete the proposal. So once I'm ready to complete my proposal, I'll again go to the sign-in page, sign in with my email address and password. I'll click the Login button, and it will take me to my account page. And you will see at the very top, there's a number of applications that would be listed if you've used our system possibly before, or now it's going to tell me that I have a new proposal that I can complete, which is the Kansas Breastfeeding Initiative RFP proposal. So I would go ahead and click on that link, and it's going to take me to the full proposal that I'll need to complete and submit by May 15th at 5 p.m. Again, that 5 p.m. deadline, once that time hits, we'll take the proposal offline. So again, make sure that you've submitted your proposal in enough time that you can get it in within that 5 p.m. deadline. So at the very top of the page, you'll see numbers for different sections of the proposal. If you wanted to work on the budget and justification page, you could go ahead and click on the 3 at the very top and start working on that first, and then go back to the cover page. I'm just going to go from page to page as we review this online proposal. So again, it's going to ask for your organization information. So what you filled out on that letter of intent will automatically pre-populate into this proposal. If you want to make any changes, you can do so at this time, or you can just leave it as you entered it on the LOI. Next, we're going to ask for the primary contact for the organization, and that's going to be the individual that would be authorized to sign off on an agreement if your organization is awarded a grant. And then the next section will be that primary contact for the proposal. So again, that's going to be the information that you entered on the letter of intent of who would need to be contacted if there's questions about the proposal that has been submitted. And then at the very bottom, we'll ask you to give a title to your proposal and then enter the project starting and end date. Once I've completed this page, I would go to the next page. And this next page is going to take me to the proposal narrative. So simply it's telling you to fill out the proposal narrative, which would be a Word document, and make sure that you're answering all the questions that are outlined in the RFP document itself and adhering to the page limits described. So once I have my proposal narrative completed and in Word format, I would simply attach it to this page by selecting the Choose File button. And then it's going to ask you to search for that Word document that you've just completed for the proposal narrative. So I'm going to find my proposal narrative, and then I'll click on the Upload button. And once I click on that Upload button, I'll know that it's been uploaded and attached, since it will tell me that my file name has been attached and it's been uploaded on today's date. Once I've uploaded the proposal narrative, I can go to the next page, which is going to be the Budget and Justification page. So first, we're going to ask you to enter the amount that you're requesting for your proposal. So again, this amount can be up to $100,000. And then we'll ask you to complete the Budget and Justification template. Now, this is one of those templates that's on our website. So you'll simply complete this Budget and Justification template and upload it in the same manner that we did with the proposal narrative. So once I've completed this page, I can go to the next page, which is going to be the Financial Relationship Statement page. Again, this template is on the Kansas Health Foundation website, and I'll fill out this short little template, upload it, and then I can go to the next page. This next page is going to be the Acknowledgment of Agreement review form. So again, this form is available on our website, all in that same section where you'll complete the template. You'll complete this template, and then you'll upload it to this Acknowledgment of Agreement review form page. Finally, the last page is going to be the Attachments page. On this Attachments page, we'll ask you to upload a number of additional documents. The first document that we'll ask you to upload is any resumes. So if you are describing any positions within your proposal, we'll need you to upload a job description or a resume of those positions. And then depending on what type of organization is applying, we'll need a number of different financial documents. So we'll need an IRS Form 990 unless you're a government entity that's applying. We'll also need a recent audited financial statement or a balance sheet. Again, if you're a government entity, you will not be required to upload that document. And then we'll also need an audited financial statement. And again, that's only required for those organizations that are 501c3 organizations. And all of these documents are going to be attached in the same way that we did with the templates prior to getting to this attachments page. So you would just scroll to the very bottom of the page in the upload section, select the document that you're going to upload. So if I want to upload my IRS Form 990, I'll pick that document from the drop-down. I'll choose the file on my computer and then select the upload document. So once I've completed the full proposal, I would click on the Review and Submit button. Again, that's going to take me to a page that will give me a look at my entire proposal one last time before I decide to hit the Submit button. And once I do click on that Submit button, you'll get an email again letting you know that we have received your proposal and also letting you know that grant awards will be announced by June 3rd. So now what we're going to do is open it up for questions. So if you have any questions, go ahead and type those in the question box on the right-hand side of your screen. We'll go ahead and read those questions off and try to answer those questions for you. So it looks like we've received one question so far. And that first question is cost effectiveness defined as cost per person served or by some other measure?
I think we would be looking at it in both ways. Cost effectiveness, you know, in terms of what you've outlined for your proposal, does that seem reasonable? In terms of what you're proposing to do in comparison with others. You know, also looking at kind of the ratio of people served and the dollars being requested as well.
Again, we'll have the recording of this webinar and the PowerPoint slides up on our website middle of next week. So you can go ahead and share this webinar recording with others. We'll continue to leave it open for questions. So again, if you have any questions, feel free to type them into the question box on the right-hand side of your screen. Another question we just received is, are letters of support allowed or encouraged?
No, we don't have that as a requirement in the RFP.
Yeah, and if you do
submit them, they won't be reviewed. The next question we have is it $25,000 to $100,000 per year or for the 3-year time frame?
That would be for the 3-year time frame.
We just received another question. How would the money be dispersed? So once you sign off on that acknowledgement of agreement review form, you reviewed our agreement, we pay all of our grant funds via electronic funds transfer. So we would get those funds out to your organization before the grant start date, which is July 1st, 2015.
Elisa, one thing to add from the United Methodist Health Ministry Fund on that, if you receive funding from our side, it will also, there's a possibility depending on that it may be paid out either on one full payment or kind of dispersed out quarterly through the grant cycle from ours. But it would be electronic payments.
Another question we just received is, can an organization submit more than one proposal, especially if they are for different projects, one inpatient, one wider community base?
You can submit multiple proposals. You know, we would be looking at basically awarding the best proposals received. So there's nothing in the RFP that would indicate that you could not submit multiple proposals, but you know, we would only be awarding one to a particular organization.
Another question we just received is, can we get any information on who is on the webinar today?
No, we don't have that information available to release. Other questions?
Another question we just received are some activities allowed to be subcontracted out?
That's a good question. You know, I guess it would just really depend. You know, that we may have to kind of look at that and talk offline about that. You know, it's just really going to depend on what you're proposing. And Katie, do you have any sense on that as well?
I mean, as far as, again, as I'm thinking about, like, if it's a collaborative approach and it's something where the services are kind of being taken care of by, you know, one lead organization, then other funding may be allocated out to some other organizations. I guess that would be my thought as far as not really being a problem, but I would agree with you that I think that we need to review it and depend on what is proposed. So.
Well, if there are no other questions, we would certainly like to thank you for, oh, looks like we just got one in.
Okay. Another question we just received is, what about costs related to improving breastfeeding areas?
I'm not exactly, you know, have the specifics of what you're referring to when you said related to breastfeeding areas. We might need to, if you, because I need a little bit more information, I would think so, but we may need to talk offline. New construction, in terms of if you're actually needing to
build a building or something to that effect would not be an eligible expense.
Another question we have is, are universities or schools within universities eligible for funding?
Yes.
Another question we have is renovation of a current location allowed?
Conceivably, yes, that could potentially be done. And here again, it's going to be, kind of depending on how extensive the renovations are, but yes.
Another question is, could the grant money be used for education and material for our health department Healthy Start home visitors?
Katie, do you want to handle that one?
Sure. I think on that one, again, if it's that's a pretty specific question around that, but I guess it would be a twofold thing for me, and Sean, please interject if you want to, but I keep thinking that just educational materials, I don't really know how that would tie in for specifically with like the 9 CDC strategies, but if it's something that you're as part of a proposal, plus again, our minimum amounts that we're awarding are $25,000 and thinking about cost effectiveness. So those would be some of the concerns I'd raise as far as with that. Sean, does that work for your response as well?
Yes. I mean, we would be looking to support a comprehensive approach.
Correct.
So, and really focused on those CDC strategies, as Katie mentioned, so that may be a part of it. But, again, it's really going to be taking a look at what you're proposing.
Mm-hmm.
Other questions?
Okay, we have another couple of questions that just came in. The first is, are the 3 primary outcomes from the Kansas Breastfeeding Summit a primary focus, or are the CDC strategies most important?
The CDC strategies would be where we would want your attention and focus to be, because they are expanded. The thing, the 3 overarching strategies that came out of the summit was essentially what happened at that time as a result of the summit. But as you think about putting together your proposals, we do recommend that you take a look at that, but really focus in on those CDC strategies as it does go beyond 3 that were mentioned, and that's really where the focus should be. Katie, your thoughts?
No, I agree on that, especially there were many great things that emerged from the summit, and so that's why we've tried to encourage people to consider really thinking about reviewing the entire report and not just those 3 primary strategies. Again, that was a snapshot of the day and who all was represented during that time. So I would not say it has a higher precedence over the other ones or other ideas that emerge utilizing the 9 CDC strategies.
Yes, and a lot has happened since the summit. So again, we recommend, connecting with partners, talking about what's currently going on, how things are being addressed, and really going broader and looking at the 9 strategies.
One other piece, and just to kind of highlight on that very same thing, is the pre-recorded webinar does touch on some of the work that has occurred or projects that are kind of emerging since the summit, and so that might help you have a better idea, too, about what's going on right now.
Another question we have is, would an initiative that crosses the border to Missouri and the KC metro area be considered?
The focus would be on within Kansas. If you're, operating in Kansas and that's your focus, but you also, the work is extending beyond that, I don't see that as being an issue, but, you know, from our perspective, the primary focus should be in the Kansas area. Katie, anything different on your part?
I would definitely say that Kansas is our priority, so I would really strongly consider thinking about that portion as you're looking at your work. So.
Another question we have is, what level of evaluation is expected for projects?
We are anticipating, you know, an outside evaluator being a part of this process. So in terms of what you're proposing, you know, the requirement would be that you would work with the evaluator that we would be bringing on board, and so there could be further direction and instruction in that regard. So.
So a follow-up question is, did you say you would be bringing an evaluator on board, or is each project to have an evaluator?
We will have an evaluator that will be looking at the entire breastfeeding initiative. You know, and so if you're thinking about evaluation in terms of your specific initiative and what's happening, that's fine. You know, at this point, we kind of need to wait until the proposals come in and look at our overall evaluation approach. So perhaps that would be something that we can talk about a little bit further offline as things progress. Katie, from your end, any different response?
No, I would just say at this point, I don't really think there would need to be somebody that they're hiring or working that into the budget, correct?
Right.
Yeah.
You know, the focus should be on the work, and you know, like I said, we'll have an overall evaluation that's occurring for the entire initiative.
From the Kansas Health Foundation and United Methodist Health Ministry Fund side. I think maybe that'll help answer that.
Any other questions? Well, if there are no other questions, we, again, thank you so much for joining us for today's webinar, and we look forward to receiving your proposals. If you do have any other further questions, please don't hesitate to reach out to either Katie or myself, and we will be happy to connect with you. And again, we will be posting these Q&As to our website as well. So thank you so much, and have a great weekend.